Hi, everyone. It's Melissa Secord, National Executive Director for Celiac Canada. And today I am so pleased to give you a 2023 year in review. Thanks to amazing people like you, we were able to accomplish so much last year, and I'm pleased to bring this report for you. Our vision is that every person in Canada with celiac disease is diagnosed and empowered. And while bringing awareness and respect, we want to develop evidence-based tools to foster a supportive community to empower people with celiac disease and their lifelong journey. And all the decisions and all the programs we do are all based on core values of empathy, integrity, and adaptability. Last year, we started the year with a name change to Celiac Canada. This was to better reflect our charitable purposes, our vision, and our mission. We celebrated our 50th anniversary from two women in Kitchener-Waterloo in 1973 who held their first meeting at the Kitchener-Waterloo Hospital. Kay Ernst and Frances Murphy knew more had to be done for people with celiac disease in Canada. So we kicked off our milestone year right back in Kitchener-Waterloo in February last year. We honored some amazing celiac CCA volunteer changemakers. We celebrated our history. We presented a plaque to the Kitchener-Waterloo Hospital to commemorate that very first meeting on a stormy February night in 1973. We held a food drive. We received lots and lots of plaques from members of parliament and local politicians. And we also had the Minister of Health announce the permanent blood testing coverage in Ontario at our very event. We also launched a 50th anniversary website. It's still available for you to review at celiac.ca. And we celebrated 5 decades, 50 years of accomplishments and milestones. We also celebrate and share images of our events. We celebrate 50 years of impact of volunteers who helped us get to where we are today. We have people wishing and giving hopes for the next 50 years. And we also let people know what we'd like them to know about celiac disease. So I encourage you to check it out. Then we went on to Parliament Hill on May 1st, where we kicked off Celiac Awareness Month. We held our first ever gluten-free breakfast on the Hill for our 50th event. It was the start of the creation of the new Parliamentary Celiac Caucus, thanks to a Member of Parliament, Sonia Sidhu. We celebrated collaborations with Health Canada, and you'll see in the bottom right, we awarded some certificates for the long-standing collaboration to help keeping people safe across Canada. During that day, we held numerous meetings on 3 key issues on tax and affordability, advocating for the incremental medical tax change. We were looking to improve diagnosis and access to safe food. And we also, during the year, had many submissions and presentations. And I'd like to thank Roberta Kramchinsky and our Federal Advocacy Working Group for making that day a success and throughout the year. Our 2020-2022 strategic plan was extended by a couple of years, and to continue the work accomplishing the priorities of the board. We were promoting evidence-based solutions, strengthening standards, ensuring financial sustainability, and increasing education and awareness. Our board has been busy at work this past year, gearing up our next strategic plan in 2025, and it's really exciting, and we'll be looking forward to sharing that with you soon. So the first pillar of excellence that we're trying to move forward is promoting evidence-based solutions. Our goal is to have a functional professional advisory council. We want to stay abreast of international and national research. We want to make sure that our programs and education advice are rooted in science and evidence. And we want to regularly publish statements and communicate that to our stakeholders. So this year, our professional advisory council with gastroenterologists, dietitians, doctors, and agri-food scientists help guide our education throughout the year and our rooted in our work that we do and the materials that we put forward. They also award a James A. Campbell Research Grant and Young Investigator and to encourage new research towards a cure. Our State of Celiac Disease Survey was launched in 2022, and throughout this past year, we had a PhD candidate doing a deep dive 12-month analysis on the data. We also had our dietitians working group put together 5 new great resources that will be shared with dietitians in Canada, the UK, and Australia, and which is great towards educating their care for people with celiac disease. And we also completed an Indigenous study. We also had our PAC work on an international clinical practice guideline review to help support our own development of Canadian-based guidelines for the future to improve diagnosis and management of your disease. Here's our Professional Advisory Council. We're really proud to have some internationally recognized individuals guiding our work. Thank you very much for that volunteerism throughout the year. In terms of further work that we've done, our evidence-based work is supported by Kaylee McCauley and Nicole Byram. And our help desk emails and calls continue to be very active, and we thank our volunteers for keeping those calls answered and our emails opened. Of note, our team developed 13 new patient resources to help people with celiac disease get access to the very latest information, and like to thank our Master's Nutrition intern students who are a vital part in helping us deliver that work. Our annual conference focused on empowering individuals was a great success. We had really high ratings for the overall quality of the event. 94% said their expectations were met or exceeded, and 95% learned something new. So if you haven't checked out one of our online conferences, please do so. We do have world-class education every November. And collaboration is key. We collaborate behind the scenes with many groups, and these are just a handful to help us bring forward new programs, services, or research. Strengthening standards. This is all about advocacy. We want to advocate for gluten-free food, medication, and improve standards of care. And how we did that is we've reached out to 35 more Health Canada contacts. As you know, we got the Ontario blood testing pilot covered. We looked at reviewing our gluten-free certification standards. We participated with industry and BRCGS, who runs our program, to make sure that it is at the highest standards as possible in the world. We have 6,000 products that are certified, and you should check them out on our gluten-free product finder on our website. And as I mentioned earlier, we had the Parliament Day, and we are lucky to have our new Celiac Parliamentary Caucus created. And here's just some more snapshots of our Parliament Hill Day. Sonia is to do in the pink on the left, along with her daughter in the plaid jacket. She has just been diagnosed with celiac disease, so it's a real personal passion for her. And we were really lucky to also have our Ottawa chapter on the right supporting our event. We really appreciated that tag team. And continuing on with strengthening standards, we participated in the Safe Long-Term Care Act consultations, and we're really thrilled to have 100 patient submissions help us championing this issue for seniors in long-term care. Parliamentary Research Caucus presentations. We weighed in on the future of food consultations by Health Canada, which are ongoing. And we know that from the State of Celiac in Canada survey that transportation and travel is an important issue for you. So we released a survey, and 1,600 people completed it, and that'll inform our advocacy in the years to come. Increasing education and awareness. We were really thrilled to this year with the awareness and education that happened. We had 8,000 people join us over our social media posts. We have 100,000 in our online community. We had 17,000 people take our checklist to see if it could be celiac disease. We had a great first ever Kids Teach Kids Day. We had more subscribers, more people checking out our Celiac Month. And a real pride for us is we had 24 locations across Canada during our International Celiac Day, Shine a Light on Celiac Disease. And we have some really great global partners supporting us. And we're really pleased behind the scenes to create a new food service guide for hospitals and long-term care. Sue Newell, seen here, had expressed a challenge trying to find her mother assisted living for her celiac disease. Sue ended up caring for her mother at home because she couldn't trust the facilities to be safe. So board member Doris Foster, along with Masters of Nutrition student and Shelley Case, worked throughout the year to research and develop a new tool and resource for hospitals and assisted living, and that'll be available. She is available now this year. And just some more highlights of our May Celiac Awareness Month. We shine a light on 24 locations across Canada. Many thanks to our wonderful chapters for participating. Growing list of international partners from Republic of Georgia, US, England, and Australia. We had some federal ministers share video messages. We held a series of webinar Wednesdays throughout the month, and our chapters held food drives under our Save Me for Gluten-Free banner. We also did outdoor public advertising on Canada's busiest highway, the 401 series. We ran public service radio ads on CBC TV and ads in prominent physician journals across Canada during the month. We also held our first coloring contest for kids, and we had a great response. And we also asked people to promise to make a difference during our 50th celebration year. Thanks to our friends at Promise Gluten Free for their support. And ODOS and CCA teamed up on our very first Kids Teach Kids Day school activation. And on May 16th, that International Celiac Day, we had 119 kids leading presentations in their classroom, and ODOS supplied amazing, delicious gluten-free brownies to those participating classrooms. So thanks all those amazing kids ambassadors for helping us out. And our leadership. We couldn't do all the work that we do without this wonderful list of a volunteer board of directors. It is a skills-based board, so we look for people to fill certain skills and experience, and we're really grateful for all their expertise in advancing the work that we do. And behind the scenes for ensuring financial sustainability is you. People like you stepped up for celiac disease. Some of our highlights were participating in that TCS Charity Challenge in October last year. For the past 5 years, we had over 50 participants help us raise $33,000 and included winning a third prize for most fundraisers. And we had participation from all across Canada. It was great. And we also like to thank our sponsors. A lot of them are numerous food manufacturers, and we really appreciate their support in helping us advance programs and services. And speaking of programs and services, our 10 local chapters help provide local-based resources and support and programs. We have a regular regional council presidents where they can come together, and we offer a chapter resource portal so they can access tools and resources to support their work. And here's a list of the chapters. And if you see one that's local to you, I encourage you to check it out. They offer some local Facebook groups, outdoor dining activities, pancake breakfasts, webinars, events, and a lot of the local information that you need for your everyday. So check them out. And here's the list of our team that was the backbone of the work we did. Julie Green, Kaylee McCauley, Leah Vlasic, and Nastasia Lewis-Williams, supported by Gloria, Francis, and Nicole. And over the last couple of years, we've raised over almost $3 million. We've seen a 120% increase in our Facebook group community. We have empowered 108,000 people with education, and we've seen our subscriber base grow by 45%. We truly are growing and helping getting more Canadians empowered and diagnosed. And if it wasn't for you, our 4,000 donors, none of this would be possible. So thank you very much for making 2023 a great success. And we look forward to a same great year in 2024. Thanks a lot.